Hi there. Today we're going to talk about our recommendations for 5 care providers that we think every pregnant person should have on their team throughout their prenatal journey.
The first provider that you might want on your team is a chiropractor. So a lot of people experience pelvic pain in pregnancy, lower back pain, or even chronic headaches. So sometimes that has to do with an alignment issue. As you grow your baby, it can pull the weight of your body out further than it's been in the past, and that can cause some issues with how your spine and how your pelvis are lining up. So a chiropractor can help to bring things back into alignment and really alleviate the aches and pains of pregnancy, as well as creating space in the pelvis for your baby to get in an optimal position to allow for an anterior position and a vaginal birth.
The second type of provider that we recommend is to get an acupuncturist on your team. Acupuncture can be helpful for a lot of the challenges that come up with pregnancy and a lot of the symptoms that are not as wanted. We recommend acupuncture for headaches, for nausea, vomiting, for physical pain, and then also to prepare the body for labor at the end of 3rd trimester.
Another care provider that you want on your team in the childbearing year is a lactation consultant. So whether you've breastfed before and you had challenges with it, or this is your first time breastfeeding, you might want to have somebody in your back pocket that you can get in touch with if things don't go as planned. So as midwives, we make recommendations for lactation consultants who do home visits and can help people meet their feeding goals, but it never hurts to have made connections with people, especially if you are anticipating that you might have challenges. If you have a history of breast surgery, if you have a history of challenging breastfeeding relationships, if you have had, insufficient glandular development in your life, or if your care provider in your pregnancy has told you that they think you might have challenges, it can be great to get in touch with an LC ahead of time so that you're ready if you do end up having some challenges feeding your baby.
The 4th type of provider we recommend is having somebody available for primary care. And that looks different for everybody. That might be a naturopath, it might be a medical doctor, it might be somebody who works in obstetrics if that pertains to your situation. But I would say that most people in our care, if they are on medications for one thing or another, be it a thyroid disorder, mood disorder, or anything in their history unrelated to their pregnancy, that they're being seen on occasion, pretty infrequently, but still seen at some point throughout pregnancy by their primary care person. And for a lot of people that we see, that tends to be a naturopath.
And finally, we recommend that people have a relationship with a physical therapist. If this is a subsequent pregnancy, a lot of people will have pre-existing pelvic floor issues from not having gotten full healing after their last pregnancy, or sometimes people have pre-existing physical issues from earlier in their life, from sports injuries, what have you. So definitely during pregnancy, some people use PTs, and then certainly in the postpartum period, we often refer people for pelvic floor therapy, because whether you have a vaginal birth or a cesarean birth, growing a baby, the weight of a baby, and then laboring is really intense on your body and on your pelvic floor. If you have to have a surgery, that means that there's a lot of muscle and fascia that is cut in order for your baby to be born. And if you have a vaginal birth, it means that your pelvis is opening and all that pelvic tissue is opening to allow your baby to come through. And a lot of people need some extra support after going through that in order to return to a state where they have high function and low pain. So pelvic floor therapists and physical therapists in general can really help with that.